welcome to today's episode of Public Health Spotlights. I'm joined by Angharad Shambler from London Borough of Haringey, Senior Public Health Strategist within Health Protection. So Angharad, can you start by sharing a little bit about yourself, your personal story, and what initially drew you to public health as a career?
Definitely. And thank you for having me to talk with you today. So I guess I've always had an interest in public health ever since I was young. Initially, I had a real interest in food and nutrition. I remember buying the British Dietetic Association manual when I was about 16, convinced I'd be a dietitian. But I went to university and did a Bachelor of Science in medical science. So I knew I wanted to go down the science and health route, but not quite sure what yet. And I did an optional public health and epidemiology module in my third year,
Nice.
and I loved it. So I stayed on and did my master's in public health then and there. And since then, I've had a variety of roles in diabetes prevention service delivery and management, diabetes transformation, sexual health, health protection and health improvement, and across lots of different settings. So the NHS, integrated care boards and local authority, where I am now. So as you said, I'm a senior public health strategist, and I've been here for 2 years at Haringey Council.
Amazing. And what sort of drew you to Haringey? Why Haringey?
Yeah, it's a really good question. I think Haringey is one of the most ethnically and culturally diverse boroughs in the UK, actually. So this post stood out to me as a way to challenge me to further develop my knowledge and skills in addressing and reducing health inequalities. And also I had sort of good previous knowledge and skills in health protection, as I'd previously worked as a strategist in Waltham Forest. So really those were the main reasons drawing me to the role.
Nice. And what aspects of your current role do you find most fulfilling?
So I really enjoy the collaboration and the partnership working. I think there's nothing like pulling off a task or an intervention as part of a real tight sort of cross-departmental group and seeing it actually be implemented and actually helping others. So I think that's really what I find most fulfilling.
Nice. And for those listening, could you explain the role of a senior public health strategist in health protection? Like, what would your typical day-to-day look like, and what are your key areas of responsibility?
Yeah, so my key responsibilities in my role really include sort of providing assurances that vaccination and screening services, as well as infection control, meet the needs of the population, and also contributing to addressing inequalities in the uptake and delivery of these programs. My role also forms a main role in preparing the council's preparation and responding to local health protection incidents and outbreaks and other emergencies, and really working in partnership with lots of different partners from the NHS, other council services and our local communities as well. Day to day, as I'm sure many people in public health and health protection would say, it varies. So I may be chairing a routine vaccination working group or a severe weather preparedness meeting, or responding to a concern a school might have on a potential case of disease. So the list goes on.
Nice. I mean, it sounds like it definitely keeps you busy, and there's sort of, always areas of health protection to look at. But what would you say some of the biggest challenges today within health protection are?
So in Haringey, I think some of the biggest challenges lie in reducing the inequalities and uptake of childhood immunisations and cancer screening. And we work really closely in partnership with primary care, our GP Federation, our cancer alliances and communities through engagement outreach to really try and improve that uptake. You've probably seen in the news stories about rising cases of measles and whooping cough. So they're both vaccine preventable diseases which are re-emerging due to those low vaccination rates. But also I think climate change and global warming, particularly heat waves, are also continuously impacting on health. And so I see that as an ongoing challenge in health protection too.
Climate change is not something that I've personally sort of like hugely associated with public health. How do the two sort of interlink?
So I have a lot to say about this one, actually. I think climate change has been and continues to impact health in a number of ways. And I think there does remain that lack of awareness and understanding of the links to health. among health professionals and particularly the public. So, for example, rising temperatures related to global warming is causing increased and prolonged severe weather events, increased natural hazards, so storms, flooding, droughts, and wildfires. And just to give an example of this, so some people may remember during summer 2022, the London Fire Brigade here in London declared a major incident. There was a wildfire in East London, and it destroyed around 20 houses. And there are many secondary health impacts from damage or losing your home. So I guess other ways that climate change could sort of relates to public health is poorer air quality, thunderstorm asthma, food and nutrition insecurity. And that can also lead to sort of increased pressures on that cost of living crisis, for example, and an increase in infectious disease. As well as cancer risk, being out in the sun, skin cancer, is also a real sort of threat to health. I think just to also mention mental health. So it's an area that one wouldn't necessarily associate with rising global temperatures or climate change. But there's more and more evidence telling us that higher temperatures increase adverse mental health outcomes and exacerbate people's symptoms. And even flooding, which can be brought on by heat waves, is also linked to adverse mental health too. So I think they're the key things that sort of link climate change and health.
Okay. And we have sort of covered quite a bit of that, but is there anything sort of particularly in terms of severe weather impacting Haringey residents?
Yeah, definitely. So we've done lots of work in Haringey on this, and particularly starting looking at some of the data and how it's affecting our residents. So I think just to frame it, in terms of global warming, since the 1980s, there's been a 6-fold increase in heat waves worldwide. Wow. And average sort of global temperatures are expected to continue to rise by 4 degrees by 2065 too. So this problem isn't going away, and it really needs to be at the forefront. So I think heat waves affect people's health directly by exacerbating long-term health conditions, mental health, which you just talked about, and increasing demands on our local hospitals and services. It can cause sort of heat illness and heat stroke, which, are fatal and do require that increased capacity from A&E. And, that increased capacity means disruption for others who are needing to use those services as well. So there's that domino effect.
Sure.
And I think indirectly, there's things like increased risk of accidents. There's things like drought and air quality, which you talked about before, which obviously impact on people's health. We also know that, global warming and heat waves, they affect people differently. They affect our population differently. So those that are over the age of 65, those that are living alone or in a care home, pregnant women or very young babies, people who may be experiencing homelessness, those with comorbidities, which you mentioned before, those with a physical profession where they're working outside a lot. These people are at higher risk of adverse outcomes in hot episodes. And this is a huge proportion of our population in Haringey. So to put into perspective, we have around 27,000 people in Haringey over the age of 65, and that's not including the other groups I mentioned. So, it's a huge focus for us in, protecting those people from sort of, heat waves and global warming generally.
Sure. From your perspective, what is the role of a local authority public health team and in addressing climate change and its impact on health? And could you sort of perhaps touch on the importance of cross-department collaboration and any key policy documents?
Yeah, so it's the responsibility of each local area to ensure that preparedness and response plans are created, tested, and regularly monitored to ensure, high quality services sort of are continuous and to protect the health and well-being of our populations during these adverse and severe weather events. So the UK Health Security Agency recently updated their adverse weather and health plan, and that really acts as a guide for local authorities for this wider adverse weather planning, which can affect people's health, but also some other sort of wider climate change adaptation arrangements as well. And this is a plan that has really heavily influenced our action here in Haringey. And we work collaboratively across the council, working with emergency planning colleagues, our Borough Resilience Forum, our communications team, carbon management team. I could go on, particularly in ensuring sort of actions are relevant and information can be cascaded when required. So there are lots of opportunities for us to protect the health of our residents, particularly from these areas, global temperature and severe weather.
With increasing global temperatures and severe weather events becoming more frequent, how are you managing these challenges in Haringey? And is there sort of any examples of an overview of work being done in partnership with others that you could give us?
Definitely. So in Haringey, we've recently published our Heatwaves Joint Strategic Needs Assessments, which was a very useful piece of work, both in identifying sort of that new intelligence. So, for example, excess mortality in Haringey during heatwave episodes, or identifying which settings were most at risk using the Greater London Authority and Bloomberg climate risk maps. The exercise also helped us to map what was currently being done across the council to mitigate and adapt to climate change and improve resilience to increasing temperature and heat waves. So in addition to that, we also ran some community and professional engagement events, which was really helpful sort of in understanding how people and services coped in the heat. And that really helped us to also identify gaps. And so we stood up here in Haringey, we stood up a severe weather preparedness group with membership from lots of different council officers in the council to support the action. Okay. And I got some specific examples of kind of outputs, from that group. So we have a kind of a standard operating procedure for dealing with heat health alerts, which come from the UK Health Security Agency and the Met Office. We improved our communications to the public through sort of printed and online resources that were really easy to understand and help people to better cope in the heat. We also developed sort of a very brief advice for frontline staff. So anyone who was working very closely with residents, it contains sort of information on, coping, how the heat affects people's health, but also signposting to those other services because of the wider impacts that heat brings to health. And I guess cool spaces. So cool spaces are a sort of an evidence-based intervention to help people cope in the heat where their homes can't, they can't put up with the heat essentially. So we're trying to increase those across the borough and making them sort of more accessible, and also making sure people are aware of, where are water fountains, where are public toilets, where are places where people can sort of have water and get refuge during heat waves and extended episodes of heat. So those are some of the examples.
It sounds like you've been doing some great things in Haringey. Are you able to share any examples of best practices from local government or other providers that have been particularly effective in improving preparedness for severe weather and climate change?
There are so many local authorities, both in London and wider, doing fantastic things in this space. And I think more does need to be done to share this across teams. So, I think, I know Islington have been doing some great work on engaging with citizens and residents on climate change and improving their communications to residents during severe weather. I know Richmond and Wandsworth in South London have developed modules on climate change and how it affects health as part of an education to professionals. And Wales have done a really good job on climate change needs assessment. And I'm sure there are many other good examples of practice that would just need to be shared. Definitely.
Nice. I mean, Haringey has clearly sort of made some significant progress in this area. What strategies or innovations have contributed to this success, and how can other local authorities look to replicate them?
Yeah, thank you. Yeah, we have worked really well as a collective team on our preparedness and response efforts, but we are still trying to work continuously on improving and developing the work. We are doing based on feedback from partners and, of course, our residents and communities. So an example I can give from last year is that we were so keen to get those new communication resources out there. But we had feedback we were putting too much heat health information out there, and it was raining. It was actually a really cold July. So, that's something that we learned, and we sort of improved our communications plan to replicate that feedback. But, a lot of information is shared at various networks and conferences. So ADPH, London Climate Change and Health Group, for example, and, the UK Health Security Agency conferences. They're great places to sort of, see what others are doing in this space. And I think, all of our teams are very happy to help others out with replicating any projects that we feel have worked. I guess, there's acknowledgement that different local authorities are at different stages of their work, but I'd always suggest reaching out to sort of neighbours or, people that have shared things at these networks to see what they've done, what have been the successes and challenges, and whether that's something that might work for your local authority.
And just going back to sort of severe weather, how does it intersect with the wider determinants of health, and why is it so important to consider this in public health strategies?
So I think earlier on in our conversation, I mentioned the impacts on cost of living and food security and mental health, which can all be exacerbated by severe weather. So I think it's really important, especially when thinking about communications to residents, either through frontline staff or resources, clearly signposting to the support is really necessary. And also severe cold weather. We haven't touched upon that yet, but that can also
quite a lot of that.
Yeah, exactly. But that can also exacerbate damp and mold. So, for example, working with housing colleagues to ensure residents know how to manage it and receive support from the council is key, as that is a real huge determinant of health. So I think it is thinking in this way that is important to consider in severe weather policy and strategies.
Nice, thank you. And why do you believe local government is an exciting place for public health professionals working on climate change and health issues? And what unique advantages do councils have in tackling these challenges?
I think that although climate change is affecting us all, particular local authorities have differing challenges and priorities in order to protect their residents from adverse impacts of climate change. So local authorities have a key role in mitigating against climate change as well. So tree planting, active travel, air quality improvement, as well as adaptation. So this is, ensuring residents know how to cope in severe weather, or retrofitting housing to be more resilient to severe weather. So for me, what's exciting is the number of different opportunities you can get to be involved in to support the climate change agenda. And I think this also answers your question about unique advantages. We have access to a wide range of teams and expertise in local government to actually do this. Of course, it also offers the unique opportunity of working closely with residents to educate them and better understand their perception of risk and appropriate advice and actions to give them.
Sure. And I imagine sort of education has a huge role to play within this. But from your perspective, what role does education and population resilience play in improving preparedness and response to some of the severe weather mentioned? And how is that? I guess, is there any way that we can improve public education and awareness in this area?
Yeah, so education to the public about the effects of climate change on health and helping them understand that it's a global health problem. It does affect their health. And of course, how they can protect themselves to stay cool or warm in severe weather are really important in protecting our residents and helping them understand why we're providing the information. It's also, I think, helpful for us to understand from our residents how they currently act in severe temperatures. And so for residents who may have migrated from warmer countries, what interventions are used in those countries that we could use here to adapt to our changing climates, and what local settings might be good for cool spaces. Our communities really know our borough better than us. So really sort of tapping in to educate them, but also understanding how they can help us is really important. So ultimately, I think more community engagement and capacity building on climate change and health is key. And I think also identifying better ways to reach out to our residents with appropriate information. So like different languages, ranges of formats, ensuring information is relevant. So for example, an evidence-based intervention to keep your house cooler is to close the windows in the day and open them at night. But that's not going to be helpful to someone living on the ground floor who may be at risk of like burglary, for example. So it's really trying to understand, what are the key messages and how can we make them relevant to lots of different demographics in our population.
Thank you. Looking ahead, what do you see as the future priorities for climate change and public health, both nationally and locally? How can we better support vulnerable population groups in preparing for and responding to climate risks?
So I think as mentioned, more targeted and relevant information for residents before and during severe weather is key, including that information and signposting to those wider impacts to health. I also think targeting like available resource for adaptation type projects is also a future priority. So for example, retrofitting of a children's centre that overheats, or planting trees to reduce air pollution and increase shade, and targeting these to areas where it is needed the most. So also ensuring that this intelligence is accessible to all relevant teams across the council. So, your sort of teams that are focused on planting trees know where in the borough is, heat at its highest risk, so that we know that, trees could be prioritised to be planted there. Yep. So I think that's something that, would definitely better support sort of our population groups in Haringey. And I imagine similar, across any local authority you're working in.
And to wrap up, what would you say to other local authority leaders or public health professionals listening today? Why should they engage more deeply with climate change and health issues?
That's a really good question to wrap up. I'd say climate change is a major threat to human health and well-being. It also increases inequalities, as when climate hazards actually hit, the disadvantaged groups suffer disproportionately to others, impacting not only on health, but as we talked about, other social determinants. So frankly, I guess it has the ability to undermine and potentially reverse decades of health progress, which is something that we definitely don't want. So all aspects of health, I think, are linked to climate change, from clean air, water, soil, food, production systems, infrastructure, our livelihoods. So I think whatever portfolio a public health professional is working on, I'm sure there's a link and ways to support the overall climate change agenda.
So I know I said that was the final question, but I've just got one more question. Have you got any final words of advice to give to somebody considering a career in public health?
Yes, so it's always an exciting time in public health, with lots of opportunities to be innovative and work with a wide variety of partners. So I think if you have a passion for improving the health and well-being of others, are a good problem solver, an innovator, and want to influence policy and action, you should really give public health a try.
Nice. Thank you so much for your time today. I've personally found it really interesting, and I hope our listeners have as well.
Thank you.
Thank you.